Hello everyone and welcome back to the Medcare Podcast. Today we're talking about something that many people have never heard of, even though it can make a real difference in the lives of older adults. It's called Community Health Integration, or CHI. In this episode, we will discuss what CHI actually is, why many seniors struggle with health issues that have nothing to do with medicine alone. We will also discuss how an annual wellness visit helps identify these challenges, how telehealth makes healthcare more accessible, and why addressing everyday barriers is just as important as treating illness. Today, we are thrilled to welcome Marni Hochman to the show. Marni is a board-certified family nurse practitioner with Medicare, bringing a wealth in clinical expertise and a deep passion for patient-centered care to our conversation. Marni, welcome to the podcast.
Thank you so much. I'm very excited to be here today to talk about such an important topic such as community health integration. It's healthcare that goes beyond prescriptions and diagnoses as it puts everything together. So thank you for having me.
Of course, thank you for being here. Now let's start with the basics. Can you explain what exactly is community health integration?
Of course. So it's a service that it's designed to help patients that have health-related social needs. And what I mean by that is, maybe they have lack of transportation, or they don't have access to healthy foods, or they have financial problems, so they have trouble paying for medications, housing instability, and understanding really how the community resources work. A lot of people don't know that there are resources out there for patients. So CHI, or it doesn't replace medical care, but it works alongside medical care. And we're able to identify needs and connect patients with appropriate community resources if they qualify.
All right. So what I understand is that CHI is not simply another doctor's appointment. It is helping people overcome the obstacles that affect their health.
Exactly. Healthcare isn't only about medicine. It's also about whether someone can actually follow their care plan.
Oh, right, yeah. Now let's talk about seniors, because many older adults face challenges that younger people don't always think about.
So you have to think about the patients that live alone, or they don't drive anymore. Maybe they have diabetes with multiple medications and really no family support, which we find so often. So everyday small challenges that you or I might not think of become huge for different patients, whether you're elderly or even younger and have medical issues. So we have patients that don't make they can't make it to their doctor's appointments because they don't have transportation. We have patients that can't pick up their medication. And mainly they don't even know where to get help. So by not taking their medications in a timely fashion, or not taking them at all, or eating unhealthy foods, it really does affect their overall health.
Right, so many people think that these are just part of aging.
Correct. But it's beyond that. It's financial, it's social isolation, and growing older shouldn't mean that you have to face challenges alone. There are community resources that are available. So the first step is identifying that need.
All right, now here's another question for you, Marni. Where does the annual wellness visit fit into all this?
So the annual wellness visit is a preventative visit, and it's designed to review a patient's overall health and help create a personalized health plan for them. In that session, we talk about their current health, their medical history, risk factors, mental well-being, fall risk, preventative screenings, and daily functioning. So we get a whole picture of the patient. In some cases, this allows us to identify social needs that the patient has. And if appropriate, we're able to do referrals for that patient to help get them the resources that they need in the home.
Okay, so the annual wellness visit isn't just another checking blood pressure. It's about understanding the healthcare on the complete situation of the patient.
Exactly. Healthcare works best when we understand the patient's complete situation.
All right, now let's talk about telehealth, because many seniors still believe that they must travel to receive care.
Right, and we're changing all that. Telehealth has made it's so much more accessible for so many patients. Depending on service and eligibility, healthcare visits can be conducted securely by telephone or video. And it's very good, or it's great for seniors that have transportation difficulties or mobility issues. And telehealth may reduce the burden of traveling. It also allows caregivers to participate in some appointments. Sometimes you have a daughter that wants to be there, but she lives in a different state. So with telehealth, we're able to have different people join, which is very nice for the patient.
Definitely. And can telehealth be used for annual wellness visits?
Yes, in certain situations, subject to Medicare rules and individual eligibility, annual wellness visits may be provided through telehealth. So patients, it's very important that they confirm with their insurance that eligibility, that it will be covered.
And Marni, I think many people understand telehealth as seeing a doctor from home. But how does telehealth actually support community health integration?
So that's a great question. Community health integration is about identifying related social needs and helping patients connect with the appropriate support. Telehealth can make that process more convenient because patients can speak with their telehealth team without always needing to travel. During a telehealth visit, a provider can ask questions about daily challenges, such as transportation, access to healthy foods, housing concerns, or social isolation. If healthcare needs are identified, the provider is able to discuss available resources and determine additional services, including community health integration if appropriate.
Okay, so telehealth is not replacing community health integration, but it's helping healthcare teams to identify those needs sooner.
Exactly. It can make it easier for patients to stay connected with their care team. While some situations still require in-person care, virtual visits can support ongoing communication and help identify concerns that might otherwise go unnoticed.
Okay, so that means that a senior who has difficulty leaving home can still have meaningful conversations with their healthcare provider, and then they can better understand the challenges affecting their health.
That's correct. So telehealth helps remove some barriers to communication, and community health integration focuses on addressing health-related needs when appropriate. And together, they can support a more complex approach to patient care.
Yeah, definitely. So let's take a look at a few examples. Okay, so example 1, there is an 82-year-old woman who has high blood pressure and she keeps missing appointments, and her biggest problem is not medication. So she no longer drives. So once the transportation challenges are identified, she can be connected with appropriate community resources if applicable.
That's correct.
Then example 2, there is a man with diabetes and he skips healthy meals because he struggles to access nutritious food. So I think that identifying these needs will allow them to have healthcare providers discussing available community support, correct?
That's correct, yes. We're able to, there are companies that, for example, Meals on Wheels or different organizations that will deliver healthy foods to patients based upon their diet, low salt, low sugar, things to that nature.
Makes sense. Now, one last example. There's a senior living alone and becomes socially isolated. So loneliness may affect emotional well-being and overall health. So recognizing social isolation will allow providers to discuss resources that may help.
That's correct.
All right, Marni, if there is one thing that our audience remembers from today, what should it be?
Your health is influenced more than just your medical condition. Again, like we discussed, if someone has diabetes and they're not getting access to healthy foods or transportation, they can't afford to go see their healthcare provider, ophthalmologist, have labs drawn, whatever, we're able to recognize that and be able to connect them with resources. Daily challenges matter. So community health integration helps identify health-related social and connects eligible patients with resources. And the perfect time to recognize this is during an annual wellness visit. Telehealth has made it so easy for many people to access care from wherever their appropriate, their home is when appropriate.
Right, because healthcare is not only about just treating illness, but also about helping people stay healthier.
Correct.
Well, Marni, thank you so much for joining us today.
Thank you very much for having me.
It's been a pleasure speaking with you about this very interesting topic that is CHI. Thank you for being here.
Thank you for having me.
Now, if you would like to learn more about Medcare, your annual wellness visit, or community health integration, you can visit our website or contact our team to learn whether these services may be appropriate for you. Thank you for watching, and we'll see you in the next episode.